The second half of primary first aid is talking about breathing emergencies. So that's where we're going to pick up today on our slides. So breathing emergencies can vary from something as simple as minor choking to somebody that has complete airway obstruction and cannot get any air in or out. All right, either way, we're going to consider these all to be life-threatening emergencies. So a breathing emergency can involve any part of the respiratory system. That's talking about lungs, your throat, your nose, anything that is involved in circulating the air throughout your body, okay? A little stat that we have for you is if the brain does not receive oxygen, the cells will start to die, okay? Just like when we were talking about tissue injuries and the cell death starts to occur when we have all those increase in blood flow going on, the same thing goes on in our brain, okay? When a brain cell dies, it does not come back, okay? If the brain goes without oxygen long enough, all the cells will die and you will die. So a little stat that we have here, as little as 4 minutes without oxygen can cause permanent brain damage, okay? And that can be a variety of complications. Some people will have damage to the part that doesn't, that controls speech. And so people are no longer able to speak after a brain damage injury, but it just varies. So the first part of primary first aid that we will cover today is talking about mouth-to-mouth breathing, okay, where you as a rescuer are breathing for your victim, okay. This is also known as rescue breathing, okay, rescue breathing. You are going to place your mouth on top of your victim's mouth and inhale into their lungs, okay. We will be practicing this with the dummies. Okay, after you have put a breath in, you do need to look to their chest and do just like we did in our look, listen, and feel. For our ABCs, you're going to turn your head and see if the air is going into the lungs, okay? Because that's going to be a big thing. If the chest does not rise, then that means that the air is not making it to the lungs, okay? More times than not, that means that there's something blocking that airway. They could have choked on something, okay? Well, the thing that you want to be concerned with on mouth-to-mouth breathing is going to be disease transmission. Like we learned in bloodborne pathogen, you can have diseases passed from one person to the next through mouth-to-mouth. This is one of the reasons why we use different types of protective barriers, like our masks. Okay, it's very important. So, placing your mouth over another person's mouth or over their nose and their mouth can not only pass what you have along to the victim, but vice versa, okay? So the protective barriers that we have in place to help kind of prevent this from happening should always be in any type of first aid kits, okay? You never really know when you're going to need one of these, okay? So it's very important to make sure you know where they are. Here is a couple of examples, all right? We have this one that we call a little pocket barrier, and so it folds up really small. It's very simple, okay? You're just literally breathing through the blue valve, okay? Over here, we have a one-way valve mask that is a little bit bulkier, but it does kind of make it a little bit easier to use, okay? And both of these allow you to have your oxygen going into the person's lungs, but if they, you're not having to actually put your mouth on top of their mouth, okay? With breathing emergencies, one of the big things that we see is airway obstructions, okay? The number one cause of an airway obstruction is your tongue, okay? That could be because you are unconscious and your tongue is a muscle and you lose control over that muscle. We see sometimes people that have seizures can have this problem as well, okay? But if your tongue is blocking the airway, then there's no air that can get in or out. Other common things that cause airway obstruction is your food, All right. I mean, I know we've all choked on food and gum. In athletics, we see the mouth guards. All right, are a big one. Blood, vomit, and broken teeth, all related with trauma. Okay, but pretty much anything that you put in your mouth can become an airway obstruction. Okay, which is a big deal. So the first way that we're going to deal with a conscious breathing victim. Okay, so somebody who is coherent. Hey, are you okay? They can respond. You're going to see them grab their throat. Okay, that's usually the first time that we see that somebody is choking. Okay, you might be able to hear that they are coughing. All right, if they are coughing, that means that they have air going into their lungs. Okay, it might not be enough, but they do have some type of air. All right, redness in the face, that's going to be because of that lack of oxygen. All right, and you might be able to hear that gaping for air sound. Okay, that's all because you have a conscious choking victim. Okay, here's a picture of our universal choking sign. All right, that hand's on your throat. It's natural instinct. Okay, that's going to be your best case scenario. Is you have a conscious choking victim. You want to encourage them to keep coughing. Okay, and try to dislodge the area themselves. The next one that we have is an unconscious breathing victim. Okay, this is when they are not responsive. Hey, are you okay? And they are not responding. Okay, you have to actually open the airway for them. Okay, that is how we did that head tilt, chin lift. All right, in our last chapter. All right, or in our last video. That is how you're going to help them. Okay, you want to be able to put air into their lungs. You do want to breathe for them. And look down and see, do you see their chest rise? Okay. You might be able to see an object blocking their throat when you open their mouth. Okay. If you open their mouth, you can do what we call a finger sweep. You're going to take your small finger and cup it, and you're going to literally try to scoop out whatever is causing that airway obstruction. Okay. Important thing to know about this is you can have a partial or total airway obstruction. So if it's a partial, there is a little bit of air coming through. That's what we're going to talk about next. So with a partial airway sign, this is mostly going to be in your conscious choking victims. You're going to usually see this where they're getting some air, so it's enough to kind of stay conscious, but it's not enough, so they're choking a lot, they're grabbing their throat, all right? They might be able to partially speak to you, but this is usually going to lead to our next one, which is our total airway obstruction. With a total airway obstruction, there is no air getting through, okay? Any air that you put into the body is going right back out, and nothing is reaching down into the chest. That's one of the main reasons why we look and see if we get that rise in the chest, okay? A conscious person will begin to, that red face, they will start to tear up. It won't last long before they pass out from lack of oxygen, okay? So definitely very important breathing emergencies. The next type of emergencies that we see are dealing with the heart, okay? Cardiopulmonary emergencies, okay? There's two main types that we talk about. The first one is heart attack, and the second one is cardiac arrest. Both require you to call 911 immediately. So with a heart attack, it's 12 o'clock. We have damage to part of the heart, okay? Your heart is a very big muscle in the body, and it's got tons and tons and tons of veins and arteries surrounding it that pump the blood through the whole entire body. With a heart attack, you have one part of the body that has become clogged, okay? And as you can see in the picture, it's this little area down here. It is blocked. The blood flow is not flowing appropriately, okay? And this can occur from bad diet, not enough exercise, from stress. It could be hereditary. Your family could have this just common in their family, okay? This is a medical emergency, okay? Signs of a heart attack, they're having trouble breathing. They're breathing faster than normal, but shorter, so okay? Blue skin, that's going to be lack of oxygen. They will be sweating a lot. And a big one that we see is what we call syncope. Syncope is sudden and unexplained fainting. okay, as a result of this trauma. So heart attack is a damage to part of the heart, all right? There is a clog in one of the arteries. The next one that we have is cardiac arrest, okay? With cardiac arrest, the heart has stopped beating, okay? This one will require CPR, okay? Whereas heart attack, your heart was still beating and part of the area was still working. Cardiac arrest, your heart has completely stopped, okay? You will use CPR, and this is also where the AED will come into play, which we will talk about soon. Okay, your AED is like a jumper cable, all right, for your heart. Like you start your car, it starts your heart. I have a quick video here showing a couple of, oh, well, that one doesn't want to work. I have a couple of videos showing the way your heart beats. All right, so in this image, this is showing somebody that's going through what we call VFib, okay? This is not normal. Your heart should be nice and smooth and bump, 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 bump. All right, that's definitely not what was going on with that heart, okay? The last part of this section is talking about using the AED. Okay, you'll see them everywhere you go, around the school, the mall, sporting events. They're pretty common now. And what this device does is it is used to help restart the heart. It's electrical shock that goes through these pads, which will send that electricity into the body and hopefully restart the heart. Okay, the good thing about this is you don't have to have a lot of training. Okay, they're pretty user-friendly where it doesn't take a lot of skill. Okay, you just listen to what the device is telling you. Okay, big things is the electrodes that you have to place on your left chest, all right, or the victim's left chest, and then below the heart. You're actually putting your heart in between the two pads. Okay. A little stat here says American Heart Association estimates that 100,000 deaths could be prevented each year with rapid defibrillation. It's a big deal, guys. I suggest you get to know where they are. All right. The next time we pick back up, we're going to talk about blood emergencies.